just first top shelf, top-notch work.
What do you want?
Nothing. I'm just trying to be nice.
You want something from me?
I literally do not. I literally don't.
I think you do.
Dr. Shaw's here. Our friend Jorge's here.
morning.
I was asking. Good morning. It's good to have you back on the program. I was asking you before. I really think we're going to get to a breakover point in this country where tattoo removal becomes a bigger business than getting tattoos to begin with.
You know, in the last 10 years, I've seen a tremendous increase. 10 years ago, actually, tattoo removal wasn't perfected. You know, lasers weren't all that good. They weren't very specific. And now, just like with anything, with advancements, we could give you a nice treatment, a nice result without all that downtime, without all that pain that you used to have. And so we've gone from a clinic that never had a tattoo removal laser to now 3 tattoo removal lasers that we're using
business
full-time.
is booming.
So it is, and you know, it's nationwide. It's nationwide.
And I'm thinking there's
absolutely.
got to be there's 2 deals. There's people that make some bad decisions in their life, get mixed up with gangs and all that. They want to get out of that, leave that lifestyle behind, be productive members of society, which means those gang tats got to go. And there's got to be dudes that have some chick's name tattooed on them and the thing goes south. And other women, I don't think, want to see that.
Yeah, it's actually very common. You know, we do get a lot of patients that are coming in that have a name. They've had it for several years, and, you know, they want to move on now. And so that's a very common tattoo. Patients that are going for a new job, and there's a tattoo that's just kind of preventing them from getting that new job. Or, you know, people entering the military, and if there's a tattoo on the face or the forearms, it just doesn't work for the military. So, yeah, lots of different people from all kinds of walks of life wanting to get rid of that tattoo.
And so well, I mean, how does it work? You go to Beautologie, you just, hey, I'd like to get my tattoo, and you have a...
Yep. So
you sit down with them. And
it's pretty easy. You know, we do a basic consultation. We look at the tattoo, get some information. You know, who put it on? Was it a professional artist, amateur artist? How many different inks were used? How intricate that tattoo is? Gives us an idea of how long it's going to take to get rid of this, and then we kind of share that information with the patient. It's a very simple treatment. If it's a small tattoo, something that. It might be on your forearm or face. It's something that will only take about 10, 15 minutes to do. We numb up the area.
10 to 15 minutes?
Yeah, if even that. I mean, it's a pretty quick in and out procedure. Now, it does take multiple treatments.
Now, what is it? It goes in and does it actually remove the ink that was there? I mean,
so what it's doing is it's a laser, and we call it an ND Q-switch YAG laser. And what this laser's doing, it's seeing that ink, and it causes a controlled burn of that ink. It breaks that ink up, and then your body over time kind of processes that broken ink, and you generally process that out of your body, and you get rid of it, and it lightens.
Jorge, what was this procedure like for you?
It was very unexpected to me because I expected pain, I expected a burning, and when they actually started the treatment, it just felt like a rubber band snapped on my face, because as you can see, I had a tattoo on my face. Yeah. That's the first one I'm trying to remove. And after that, it was nothing. I mean, not saying no pain at all. I mean, it's just...
Is it less than getting the tattoo to begin with?
Was it like to get a tattoo?
Yeah, I mean, what hurts more, the getting it initially or having it removed?
To getting it done. Getting it done because it's a constant needle moving on you.
Yeah.
And it's ricocheting on everywhere in your body.
The sound... Okay, a laser goes in there, busts through that first layer, it burns the ink away. That sounds like it would hurt a lot.
And obviously doesn't leave any kind of scarring at all? I mean, is it just a temporary, like a scab kind of thing?
Right. Generally no scarring at all. I mean, it's got to be done very carefully. We have to start at conservative settings, get a feel for the patient's skin. Tattoos are so different as far as the position where they are in the body, how deeply the artist buried the ink, the colors that are used. We have to use different filters, different energies, and we have to be very mindful of the patient's skin type. And so, there's varying degrees on how that skin responds. Usually it's just a little bit of swelling. There could be some blistering. If there is blistering, we got to make sure we take care of that. We can't just leave that blister alone. We got to use prescription-grade creams to take care of that blister. If you're doing that, it's not going to scar. It's going to heal just great. Now, yes, if you hit this tattoo extremely hard, you start off at a very aggressive setting, you let it blister, you don't take care of it, it's going to scar. So as long as there's an appropriate follow-up, it's going to do just great.
Then if you're talking about the different skin types, I mean, is the removal, your procedure to do it, is it different from somebody who's Caucasian as opposed to somebody who's African-American or somebody who's Hispanic? In other words, darker skin types, is there different procedures for that?
Absolutely. So, lasers are attracted to color, and we're trying to go after the color in the tattoo. But
Right.
in darker skin, that laser can get a little distracted and go after the color, of the skin. And also, if you're really tan, Caucasian, being very tan, it can start going after that tan. So there's some prep work we do. We make sure our patients are not tanning during the procedures. We have them use sunscreen. In our darker, kind of African American clientele, or Middle Eastern dark,
Right.
just darker skin types, we use a bleaching cream. That actually relaxes pigment producing cells in the skin, and that ensures that it's going to be a little bit more of a safer procedure. We use different settings as well when we first get started. A little bit more of a conservative setting in our in our darker skin patients. So there's things that we do vary.
Okay, if you got a guy like you just see everywhere with the full-on arm thing, all the colors and all this stuff, he gets up one day and goes, "This sucks." How? Because you're not going to do that in one treatment. That's obviously going to take place over a longer period of time.
Yeah, so here's the things that vary the number of treatments that you need. Professional tattoos are going to be a little bit more difficult than amateur tattoos because that ink was meant to stay. That artist wanted to make sure that ink was not going anywhere. And, the more intricate the artist, the more difficult it's going to be to get rid of that tattoo. So more treatments for the more professional tattoos. The multicolored tattoos are going to take a little bit longer than the single color black-blue tattoos. And that's because we have to, vary filters and some of the lighter colors like the oranges and yellows are a little bit more difficult to go after.
Yeah, because if the laser's gonna focus in on whatever's the whitest or has the least amount of color,
right?
Does the color of the ink's got to kind of throw that off too?
Absolutely, yeah. So but it's not impossible. We have a machine that actually goes after all colors, and so you'll probably see the darker colors lighten up a little bit quicker than the lighter colors, but they eventually do. If they're newer tattoos, there's a little bit, take a few more treatments on the older tattoos. And where it's located, the tattoos on the lower part of the body, like the ankles and the feet, there's it's a little bit more of a sensitive area. We can't use as much of an energy setting as we can on, say, a tattoo on the thigh or the arm that could take a little bit more, of a punch. Those are going to take a little bit longer. So things varied up. It could be anywhere from, we've gotten rid of tattoos in as little as 1 or 2 treatments, and there's some that take up to 15 treatments. And so there's variability there.
Wow. Wow, boy, I tell you what, people need to know this before they decide to get one to begin with, that if this thing you decide you want to get rid of that later,
right,
that it is a process.
Yeah.
That's amazing. I tell you, we got to take a break. During the break, Hop's got a full-size Billy Ray Cyrus on his back. We'll get him like an estimate. See, I'll pay for that. Oh, I thought you were all proud of that. You always take your shirt off when you're bowling while you're singing "Achy Breaky Heart" and dance around. I thought it was kind of a real point of pride for you.
I thought you were leaving that for the people that just showed up for bowling.
Just for the yeah, you got to go. You got to come to bowling to see that one.
Yeah.
That's not just for everybody. We'll be right back. More of the Dr. Shaw, Jorge's here, the whole gang. We'll be right back. It's First Look. It's Bakersfield.com, News Talk 1180 KERN. Coming to FM2, apparently, according to Richard Bean. I don't know. It's the first I've heard about it. I know Hop's scared to death to even talk about it. You were a scared little man. At any rate, Dr. Shaw's here. Jorge's here, who's had this done before. And by the way, we were talking about this during the break. This is, if you need to get this done and you can't afford to have this done, you guys actually have a pro bono program where you do this for people for nothing.
Yes, absolutely. About 4.5 years ago, we started a pro bono clinic. We weren't sure which way it was going to go. There were things kind of like this in operation in Bakersfield where a doctor would be offering his services, on a particular weekend to people that, had tattoos or preventing them obtaining a job or, just moving on with their life because of a tattoo. We said, well, let's do that. Let's make it a little bit bigger. And we started, doing it 4.5 years ago. And the first one went wonderful. We had, all these people submit their stories, and we had a committee that actually kind of picked and selected, who would be part of that first clinic. And it's kind of difficult to get everybody in. I mean, we had a huge response. Our initial requirements were that these were tattoos that were visible either on the face, on the hands, something that couldn't be covered up. And again, patients that were, kind of down and out. Their tattoos were preventing them from getting a job or, moving on with life, or
right.
It just, it was something that.
Plus, if you get mixed up in some of this gang nonsense, the wrong tattoo can get you killed.
Right. Well, Jorge could probably attest to
That's
some
one
of
of
that.
the reasons why I want to remove my tattoos
Right.
because, as you can see, I have them around my head and my face, and I have two small children, 3 and 1, ages 3 and 1. And when I walk down the street, I get negative attention that I don't need at
Oh,
this
you don't
point.
want that.
You know, I'm not even an active gang member. You know what I mean? Maybe when I was younger, I made a mistake by putting these tattoos, and I'm paying for it now.
Right.
You know what I mean? I can't even get a decent job or even a job to be corrected. You know.
Right.
And that's why I reached out to Beautologie, and I was so blessed that they're helping me out. You know what I mean? I'm one of those patients that's not going to pay, and I really appreciate that from them.
Yeah, because it gets in the way of you being able to, turn your life around and get a good job and do all that stuff and all that stuff. You can't have your ink holding you back from that.
I mean, I've been out of prison, out of nonsense gang member stuff for 6 years now, and
Right
I can't
on,
even
man.
get a
Good for you.
job. I went back to school, I got my degrees, and I got all the necessary things to get a career as a drug counselor, but I can't even get that because of tattoos.
Right.
Because the rehabs that I went to tell me, oh no, you have tattoos, and we don't want a conflict to arise with one of the clients.
Exactly. Well, you got to see their point on that deal.
And that I understand. I understand. But the frustration got to me, and then having my kids and the negative attention, not only from gang members, but not to talk bad about police, but I get negative attention from them too.
Well, sure you
know what
do.
I mean? I walk down the street with my kids, and they'll pull up next to me. Oh, you're on parole, probation, and I'm not.
Yeah.
You know what I mean? But they don't see that. But thanks to Beautologie, hopefully all that will change.
Well, that's awesome. Well, let's get that turned around. Thank you guys for doing that.
No, I mean, we love doing it. We have our staff that volunteers Saturday. We've been doing it now, every 2-3 months. We've been going strong, and it's such a feel-good thing. The staff, we hear these stories, and they're just, very fulfilling. We hear the stories, and, we've had a few people that have actually gotten jobs because their tattoos are now completely gone.
So cool.
Just all, there's a kid I remember, and he wanted to pay it forward. He was involved in gangs early on, and now he's a counselor. We've been working on his tattoos, but he's a counselor for other kids in his school, and and he's just again paying it forward and kind of leading the way and showing everybody which way is the right way. And so it's just a very feel good thing for all of us at Beautologie. We love doing it, and we're going to keep doing it as long as we can.
Oh, good for you, man. That's when you can do really quality work and have a first class facility, right, and still be decent people and good people in your community. You probably sleep pretty well at night. Now, speaking of which, why can't you just sneak up behind Jorge and just stick it like Dexter and just knock him out, and then do all this in one shot? He wakes up and he's fine. He's all done. Well, is that like a legal thing or?
Yeah, I don't know the
ethical
technicalities of that.
Yeah, probably both. I'm guessing you get in trouble on both fronts on that. Maybe you give that a whirl. Jorge, good luck, brother.
Thank you, man. Appreciate it.
What's the time frame when somebody they got a lot of them? Is this because there's a healing they have to go through before they come in and get more done?
Right, and so we're thinking Jorge's tattoo is going to be a pretty easy. I'm hoping it was a tattoo that was put on in prison, and usually those are more superficial tattoos. So I'm thinking, gosh, 5 treatments, we should be pretty much out of the woods with the ones on his forehead and even the ones around his head. So maybe 6 months, maybe up to a year at the very longest.
Still,
but yeah, and even so, he doesn't have to wait for that long. He's going to see it lighten. Probably in the next several weeks, he's going to start to see it lighten.
Awesome. Well, keep us in the loop, and we'll follow that progress right along with you. And how new is this? Because 10 years ago, this would have been. There's no way you could have done this.
Right. Yeah. I mean, so we started at about 5 years ago in our practice, 5-6 years ago in our practice. We've of course upgraded the lasers ever since, and the lasers just keep getting better. They're a little stronger, they're a little safer, they're a little bit more comfortable, and so it's constantly evolving. I mean, there's probably a new laser that we're going to be picking up here in the next year that is even better than the older lasers. So it is fairly new in the scheme of cosmetic procedures, and it's just getting better and better.
It sounds pricey. What's that machine? What does one of these laser machines cost?
Well, they're pretty expensive. I mean, they're
six figures.
6 figures, yeah. But it's like I said, it's a great procedure. We like having it.
Have you removed a Tony Stewart tattoo yet?
Oh gosh, I can't say that I have.
Well, oh yeah, nobody's going to do that
with you.
I'm just saying the NASCAR crowd is prone to tattooism, and maybe there's somebody out there that had a change of heart.
The NFL crowd, the baseball crowd, everybody's prone to tattoos anymore. It's across all sorts of lines.
Is it?
Oh, dude, come on.
Oh.
The housewives are into the getting the.
If you'll get a tattoo that says 7-minute abs, I'll pay for it. And Fraser would do it on the air too. He would. No. All right. Well, they do it all over at Beautologie. It's not just pro bono tattoo removal. If your little nitwit kid went out, and I still don't see how minors get tattoos, but it sure seems to be an epidemic.
Oh, yeah.
But that's a deal where you want to make your kid pay for it, though. You want to make them pay that off for the rest of their lives. But they also do everything. You could get a facial treatment, or you could get an augmentation of some kind. They do all kinds of work over there. It's a solid bunch of people. Tell your brother I said hey, too.
Thank you.
We've used up all our clock for the day. I'd like to thank Lois Henry, who was really nice to me, and Letitia Perez, who was really nice to me, and Miranda Whitworth, who was really nice to me. It really got out of control today. There was a lot of bitterness, a lot of angst today, but that's okay because Dr. Sean Jorge came in and they were actually super nice. Now tomorrow, banner day tomorrow potentially. Nicole Parra, who I've had this feud going for these 4 years. We are going to make up tomorrow. There may be a hug involved. I don't know, but there had better be a Seahawks jersey, or this thing's going to flip off the tracks early. I don't know what's going on with that, but we're going to talk to her. There's a 911 group, the Support Your Troops motorcycle ride they're doing. We're going to have representatives on from that. The biker community, also tattoo-intensive bunch,
Yeah.
generally speaking. And then the I Street crew will be in.
Yep.
Which means, is Stephanie Diaz back yet, or was it the
I think
Jada
she's,
herself?
I talked to her yesterday, absolutely.
Whoever it is, it'll be awesome. So that's plus we'll have your news, your traffic, your weather, Hop's zany antics.
I don't have zany.
Oh, you got zany antics, dude. Zany.
And maybe
antics.
you'll eat somebody's last precious
Again,
cookie.
see that? Grandpa,
you
poor
did
old
it.
Grandpa Lewis.
You did it. Deny it.
He, you know what?
Really?
He should lock his office. Stay tuned for the Money Wise, guys. We'll follow that up with the Sean Hannity program, and that'll be followed up directly by the Ralph Bailey program. They got more. There's more Robin Williams stuff coming. I didn't really want to talk about that today. You guys have a great day. What's left of it? You get tired, pull over. You get hungry, eat something, and you stay classy, Bakersfield.